Hello everyone, I'm Dr. Ankita Chattopadhyay from All India Institute of Medical Sciences, New Delhi and National Drug Dependence Treatment Center. Today we'll be talking about alcohol withdrawal. Many patients tend to take alcohol regularly for a long period of time and they tend to become dependent on alcohol physically. So when they don't take alcohol, then they tend to develop such signs and symptoms of alcohol withdrawal. But why are we talking about alcohol withdrawal now? As we all know, all over the country there is a lockdown, and in lockdown, alcohol is not being sold. So these patients who have become physically dependent on alcohol, if they are not taking alcohol, they are ending up in having alcohol withdrawals. But we need to know that alcohol withdrawal is treatable, and you need to contact any hospital around you so that such symptoms can be managed. Mostly, like up to 90% of cases are mild to moderate, in which the patients will have symptoms like headache, palpitations, increased sweating, tremors of the hands and legs, and restlessness, anxiety, difficulty in falling asleep. But about 10 to 15% of cases can even progress to have severe alcohol withdrawal symptoms. In such patients, we can get symptoms like seizures or convulsions. They can even progress to have delirium tremens, in which there is impairment in consciousness, altered orientation, and hallucinatory behavior or abnormal behavior. And in some malnourished patients, we can also get Wernicke-Korsakoff syndrome. But alcohol withdrawal is medically treatable, and mostly the mild to moderate cases are managed on outpatient basis only. In such patients, we just need to ensure that the patient is in a comfortable environment and that their fluid and nutrition are adequately ensured. And we have to prescribe benzodiazepines to those patients. Benzodiazepine, we usually give diazepam or lorazepam, and we also need to supplement vitamin B, especially B1, that is thiamine. Usually we give it in an oral or tablet form, and it's given for 1 to 2 weeks, and then it is slowly tapered and stopped. But we need to also keep a count or check that they don't progress to have a severe withdrawal, because it then becomes a medical emergency and hospitalization may be needed in such patients. If we have a patient of severe withdrawal, we need to give benzodiazepines as well as thiamine, but in a higher dose, and maybe injectable route has to be taken. But we need to maintain the fluid electrolyte balance in those patients. We have to check the vitals of those patients, and we have to look for any new neurological signs and symptoms in such patients. Mostly in alcohol withdrawal cases, we don't prescribe an anticonvulsant. So the message from this video is that alcohol withdrawal is treatable, and so please don't suppress the symptoms. Get to any contact any local hospital to get treated for that, and maybe you can use this opportunity of this lockdown as a blessing to get yourself treated overall for alcohol dependence as well. And the message to the healthcare professionals is that we will be facing more such patients of alcohol withdrawal, and so that we can easily manage those patients and help them get out of this crisis. So thank you.